One of the can't-miss diagnoses in hematopathology is acute promyelocytic leukemia, or APL. There are two morphologic subtypes, which include the typical hypergranular type and an unusual hypo or microgranular type. And here's an example of the typical hypergranular subtype. And the first thing we noted at low power was there was quite a few white cells. The white cell count is generally actually decreased in the typical hypergranular subtype, whereas the white count is often increased in the hypo or microgranular subtype. In the hypergranular subtype, we see these promyelocytes with characteristic folded, bilobed, sometimes multilobed, or monocytoid nuclei in the blood and or bone marrow. In the case of acute promyelocytic leukemia, the blasts and promyelocytes together constitute at least 30% of the nucleated cells in the bone marrow. The fraction of the cells included in the peripheral blood smear is variable from none to as many as there are in the bone marrow. Here in the center, we see a cell with characteristic bilobed nucleus and numerous coarse granules in the cytoplasm. We also see two other cells adjacent that are likely smaller promyelocytes and have hypergranulated cytoplasm. Here are two more promyelocytes with hypergranulated cytoplasm, and these appear to have multilobed nuclei. But you can see that the cytoplasm is immature with that dense basophilia, and the chromatin pattern is dispersed and smooth with prominent nucleoli, indicating that this is an immature cell. These hypergranulated promyelocytes may contain multiple Auer rods. In classic acute promyelocytic leukemia hypergranular type, often you will see prominent Auer rods. Some cells may even contain multiple Auer rods. Auer rods are indicative of myeloid lineage. An Auer rod is a small rod-like structure made up of these pink staining azurophilic granules in the cytoplasm. When the cells contain multiple Auer rods in the form of a bundle, they are colloquially called faggot cells, referring to a bundle of sticks. Here's an example of a case of the hypogranular variant, where we see similar sort of cells with bilobed, multilobed, and monocytoid nuclei, but in the cytoplasm we see far fewer cytoplasmic granules when compared to the previous case. The diagnostic cytogenetic abnormality is the translocation 1517 PML-RARA fusion. Acute promyelocytic leukemia also shows a typical immunophenotype, showing characteristic positivity for myeloid markers including CD13, CD33, and MPO, with variable CD34 and lack of HLA-DR. These cells are typically negative for nonspecific esterase special staining.